definitely the clinical implications that will be following in all these exposures with the evidence. And we'll finally see what we can do in our practice and what we can hope for the future. So to start with, this is a data from USA. The kind of data that is in USA is very generalizable to India because most of the apps that we do use in India are based in USA. So as you can see clearly here, this is a study in 2022. So the US society almost has almost 95% of their teenagers engaged in social media. And very clearly, they're all able to report body dissatisfaction. And in the rating of how constantly they use, 1 in 3 almost use it constantly. And with specific, we're looking at YouTube being the top there and TikTok being number 2 there. And 1 out of 5 almost use these apps constantly. And if we further look into more young children data, which is given from the US Surgeon General data, is almost the early tweens, we're talking about 8 to 12-year-old kids, 40% of them already use social media even much before their cognitive maturity. So this is pretty much very parallel to what we see in India. So we thankfully had the data reportal platform that gave the digital 2025 India report last year in January. And here we are. This is a data which encompasses all individuals of the country. So 491 million social media users are from India. And very obviously, the Gen Z dominates them, the age group right from 13 to even 25 right now. And there's a lot of spending power still that is there even in Gen Z. WhatsApp, which is in India the most commonly used, and Insta is highly rated. So these two are the common apps that we see in India. And yes, based on the data from one center, almost 8.8% of adolescents do use these apps very frequently. What is interesting from this data is males do use much more, probably because they have more access to phones, because this is the data that includes both adults also. But if you look at the amount of hours spent, it is quite interesting that females are more engaged and spend more hour within this. Again, there are many social metrics that could be determining that. But what we can see is both are equally vulnerable, and that's the fact. And one interesting qualitative study from India actually studied this in Western Delhi. So it was basically 20 participants were adolescents, and when they were asked about how it actually makes sense to them, the couple of points which I wanted to highlight is, on one end, these are teenagers who are often in reality facing a very clear ridicule based on their appearance. And on the other hand, because these digital platforms give a kind of a filter, a digital filter, they can actually modify their appearance and get clear-cut positive validation for that. On one end, they're getting the validation they need, but through a filter. On the other hand, in real life, there is a ridicule. And this kind of puts into identity fragmentation risk for these kids. And this is the kind of scenario that we are already having. And thanks to algorithmic reinforcements for this. There was a time when all we could do was just watch television or watch a series. There was a lot of autonomy for us to either give the attention to the content or withdraw the attention. So sometimes when the content is not catered to us, we can switch off or we can move away. But right now, what we are having is there is a clear-cut algorithms. Every app is connected to each other. The information is shared across platforms. What it does to us is the apps that we spend more time are automatically engraved in their algorithmic data. And those kind of data come back with the feedback, and those specific data are again and again feeded to us, such that this kind of a dopamine hit is constantly provided with algorithmic amplification. So we are now coming down in terms of our autonomy, in terms of how to switch off, because the constant hit that we're getting, we want more and more. And with this, we're also now getting more report of many teenage girls having a lot of body dissatisfaction because of all these reinforcement loops. So media is no more passive. And one interesting shift that has happened in the last decade is most of the platforms are now image-based. We rarely use text-only platforms because most of the platforms allow clear image-based sharing of material. And the top 3 would include Instagram, Snapchat, and TikTok. And what also is seen clearly is when there is a lot of image sharing, there's a lot of commentary on how a body or an appearance takes place for a teenager, which means there is a clear understanding of what everyone likes in terms of at least what the social media narrative is saying. And these kind of content a lot of times matters more than the duration, as one study reports it. With respect to the duration, it's also the content that clearly, when it is very image heavy, plays a more impact in creating a body dissatisfaction. And there is also this blurring of identity and authenticity here. A lot of these influencers also are seen at a very higher social platform because they are given an illusion of authenticity. We all know about how easy it is to acquire a blue tick these days in Instagram, and that's the whole idea here. So let's try and go into the psychological mechanisms from a developmental point of view and see what has happened for all our kids here. So this is very common. Now we can understand this very clearly. The teenage brain is very unique, right? Every area of the brain is still in the process of attaining full development. With respect to prefrontal cortex, it's sometimes reported from even up to 25 to 30 years it takes for it to attain full cortical maturity. So this top-down regulation is not something which teenagers are going to be easily accessing to. So they are very keenly going to be influenced by any kind of ventral striatal reward behavior or reward hypersensitivity. Anything that is quickly rewarding or instantly gratifying without the top-down regulation, they're going to jump into it, which gives result to a lot of high-risk behavior and a lot of impulsivity. And their amygdala, again, is going to take a lot of time to coordinate with the top-down regulation. So their emotional regulation is also still not yet present. So these things are very salient with respect to an adolescent brain. Now keep this in the context and see what is happening in the society. On one hand, we are in a society where there is a lot of objectification. The cultural practices often right from the last several decades or so has only constantly served to increase the sexual objectification of women. There's a lot of comments, there's a lot of gazing, there's a lot of unnecessary outcomes and consequences as a practice of sexual objectification. And in a society that is surrounded by that, what only happens is the internalization of this objectification, which becomes a self-objectification over time. With self-objectification, you're only going to get self-surveillance. You're constantly going to keep a mindset of a body surveillance, to constantly think from an observer's point of view how your body looks like, which puts a very young girl into higher risk of immediately feeling shame, anxiety. And we also have the concept of filter dysmorphia these days, because most of the Instagram filters immediately create this objectified appearance, which based on what others in the whole objectified universe will approve are instantly available for these teenagers. So again, these things will further and further improve the risk of being, having a shame or anxiety with regard to their own subjective experiences. And now there is also a lot of growing risk towards this objectification of what would be a healthy eating pattern. There's a lot of so-called influencers for fitness who talk about this is the only way to do it. And again, there's a lot of amplification of these weight loss content, which further puts them in risk. Now we go back to associate more of these things with Festinger's social comparison theory. Although Festinger is more known for his cognitive dissonance component, this is one of his seminal works. So this came quite almost half a century ago. What we see here is a simple two graphs. On the x-axis, you can see the affective valence. On the right, we have a positive effect. On the left, we have the negative effect. And on the y-axis, we see the level of social strata for comparison. On the top, we see the upward comparison. On the below, we see the downward comparison. And all these emotions are possible based on the social comparison. The more upward comparison, more you feel motivated. But if you have it in the positive effect, you want to do more of what they are doing according to your appraisal. And in the same way, in the positive valence, if you see people who are below what your social standard is understood as, you would rather feel that things could be worse for me, but thankfully not. So there's a gratitude. But this can quickly switch to the negative valence where you look at someone before or above you, you'll only feel jealousy. And as you see someone who, according to you, is in a downward comparison, you'll feel scorn. Now, this is a fluctuation which all of us on every single minimum basis, when we are seeing any social media, we see others in our colleagues or in our friends, when they post something, this constantly keeps happening. And now the more and more we idealize certain peers for their bodily appearance, more and more we start having an upward comparison, which results in body dissatisfaction. And there's also a lot of detox culture that goes around with respect to how obsessive one has to think about having good eating habits. And this is what we call as orthorexia, obsessive focus on healthy eating. And this tends to go on to put young adults in high vulnerability to even develop avoidant restrictive food intake disorder, because they clearly stop taking some food which they, according to their social media understanding, feel is unhealthy. And this constant comparison feeds into already an objectified brain. And finally, we go into the basis of validation. On one end, the apps, the algorithms are so amplified and designed in such a way that they clearly give you this variable ratio or intermittent reinforcement loops. Because your top-down prefrontal cortex is not very regulated, you want to go on and seek that positive reinforcement of likes, shares, and comments. And the more you do that, of that such behavior. So you want to keep posting contents that give you that positive reinforcement. Now, this happens on one side. On the other side, you also have the bystander effect of online body shaming. You constantly read how others are commenting on a little girl's or a young woman's body and how that is going to be understood by you. And then you compare it with your own self-worth and then feel, okay, there's a lot of commentary on a person's appearance. So you feel, this is a commentary which I also may get if my appearance does not meet the standard. So in order to prevent that, there is a clear negative reinforcement of appearing very objectified way of looking pretty and looking beautiful. So on one hand, you have a positive reinforcement of actual validation of likes and shares, and also you have a negative reinforcement from these toxic commentary, which has become more and more normalized in our culture these days because of a lot of anonymous members who have access to social media. Now, all this put together, if you take the biology of the brain and you see the psychological aspects of these positive and negative reinforcements, the social aspects of all our social comparison components, this is a young girl who's having no chance right now to fight. And that actually explains why probably my daughter came and asked that question to us that day. So what are we seeing right now in the clinical fallout, basically? So we have had one amazing study quite long ago in 2019 by Rain and et al. And they actually had a cohort that they followed up for a couple of years. Now, the longitudinal risk also measured what kind of duration that they spent the social media on. And they clearly saw a dose response relationship in the cohort study, which establishes a clear relationship, a temporal association between excessive social media and internalizing disorders of depression and anxiety. It is no more an association. We have cohort data for that. And it also tends to mediate the mood symptoms using the body dissatisfaction as a paradigm. And this body dissatisfaction is much more vulnerable for adolescent girls. So this categorically defines how clearly this is a causative factor in the process of a young girl developing depression and anxiety. And this also talks about, the study also talks about how much before posting there is an excessive fear of cyberbullying. We see how common it is now. A toxic discussion on an appearance is so normalized. And this tends to keep the perpetuating factor of these internalizing symptoms constantly getting worse and worse. Now, eating is again one important issue that we just saw. Orthorexia is now increasing. Everybody is talking about a healthy lifestyle, but then it's very easy for a human mind to take something and become very obsessed with it. Right? A lot of this is now leading to earlier age of concepts of dieting onset in even young tweens as young as 10 to 11. We actually had a girl who worked herself as a kind of a young influencer. She got a job in even Healthify. And then sooner or later, within a year, with all the other psychosocial components of difficulties in her family, she was put into a trajectory of going on to develop RFID. And for several years, she was actually treated as anorexia before we really found out it was basically a restrictive eating, which made her BMI come to as low as 13. And that's just one case. There are several cases of these we are seeing on a day-to-day basis. I'm sure most of the senior psychiatrists here have tremendous experience on that. And we are also having clear-cut meta-analytic evidence that shows even young children associate obesity with low self-esteem. You don't even have to wait for them to go on to teenage years where there is more comparison. We're talking about young children who was as young as 8 to 10 years. And the social impact is more and more alarming, as we can see. So on the left, I'm sure all of you could recognize that. I hope most of you who have kids talk about these. And this is very peculiar from whatever I see in the population I deal in my own family. So this is Blackpink, a very famous Korean band. And these four girls are universal celebrities. Now imagine how much of a comparison every girl has to have this very restricted physical appearance that is seen as the ideal upward social comparison. And every single day along with this, you see all the actors with their overall Instagram account amplified by their own digital filters constantly create this body dissatisfaction. So more and more urban you go, more and more this is very vulnerable even in very young school settings also. On the other side, the whole issue of, again, this fitness or diet influencers, we talk about how much misinformed they can be with their overall ideals. Who we are seeing here is a Russian influencer by the name of Zana. She actually promoted and got a lot of influenced many million followers based on her vegan fruit-based diet. And what culminated was a death of her after a minor infection. She did not have an immune system that could support herself. So these are the kind of social impact which is already created by these narratives that we are seeing right now by social media. And this in turn is now creating more and more problems for kids. And there are more clear experimental evidences. We don't yet just have observational studies anymore. We have experimental evidence for this. On one study, they took a group of children pre and post just by 3-minute exposure, both boys and girls, 3-minute exposure to Instagram, idealized images. And after 3 minutes, you again assess their mood. It was very less. They had more dissatisfaction basically from just a 3-minute exposure, a clear-cut experimental evidence. And we also see the dose response curve in terms of clear RCTs. In an RCT where they gave a group where increase in the usage and another group where there was restricted usage, clearly the group which had more 3 hours per day had obvious onset of internalizing disorders. So with unambiguous evidence that we are seeing, what are we supposed to do right now? What are we first having to take into account in our now day-to-day practice? The first things that we know is the cognitive maturity is not kind of waiting till teenage anymore. Children are, one, attaining cognitive maturity much early because of early exposure. We're looking at small children who talk about diet and their own body appearance, right? And we also have high risk groups, especially in the urban settings or in certain school cultures where these conversations are very open. So these are all places where these discussions on everyday basis are happening amongst your teenage girls. And now girls are having more open discussion about their body awareness at a much younger age also. And these are questions that you as a parent will have to face, leave alone being a practitioner. But then this again has to be understood from a surveillance point of view, that whenever these questions or these talks have begun in your family or begun in your client, there is a high risk trajectory that they have started themselves on. So that orientation needs to be given, one, to you and also to the parent who will be coming to you for help. So one of the things that would be best suited to advise is the concept of body neutrality. So what we're talking is, it is a little shift from the concept of body positivity. Body positivity was like a rebellious approach where you celebrate, or you rather be forced to celebrate whatever may be your body appearance. But then we go one step further now and we try to normalize body neutrality. In neutrality concept, we try to switch the body's concept only from judging from an appearance point of view. We believe the body has more elements to it rather than just the appearance. So we focus more on the function of the body. Your body is not just for looking good. It is also for hugging a person, helping a person, doing your household chores, doing exercise. So there are many aspects of functioning that your body has. And then you take responsibility for improving each and every function. So you slowly reduce the preoccupation of the focus of appearance contributing to the body and make the body a neutral component of multiple functions. So that in a way, again, does not force a person to be too body positive all the time, which also requires a constant validation at every single time, which is a better, safer target for you to teach a teenager and also to teach the parents. And what you also teach the parent is to reinforce the intangible qualities of a personality that this child or this adolescent is having. So we don't have to constantly wait for an achievement or constantly wait for a particular outcome for that appreciation to come. When we talk about intangible qualities, we're wanting certain qualities like hard work, you're a kind person, you're a person who's a very good communicator, you're a person who's anxious, but you're also very caring. These are kind of attributes this little girl will have, and it's going to carry for the rest of her life. Nobody can take that away from her. Those are the kind of reinforcements we want to give our little kids. And that kind of, again, brings back her self-esteem more focused on these personality and intangible attributes rather than this very small concept of appearance. And that's what we try to talk and then ensure that these kids are learning. Then obvious evidence right now, we have even RCT level evidence of digital detox. In one study where again, there were 3 groups, where one group had usual consumption, one group had 15-minute consumption to 30-minute consumption a day, and one group had an alternative activity along with 30-minute consumption a day. So what the results are showing is, as long as the usage is less, irrespective of the availability of alternating activities, just the reduction of social media actually had better outcomes in comparison in terms of depression and feelings of loneliness. Although it was short term because they went back to the phone, they went back to the same feeling, but this has to be sustained over time. So this ideal way of digital detox is where you try to restrict as much as possible. Now here becomes the challenge of how do we restrict? So complete digital abstinence is sometimes very feasible when we talk about very young children and tweens, because you have a little bit more autonomy over their life. When we have a child with autism, there is actually no brainer, right? We stop the phone. They have this extinction outburst for a couple of days and then they're fine. That's even easier than when you deal with a teenager who's, let's say, going into 10th and 11th and 12th. A lot of the school homeworks come in the phone. So phone is sometimes, it is like unrealistic for you to completely ban it, right? So this is where the concept of guided moderation comes. You need to have a grounded approach to know why they are using the phone and what are all the emotional buffers that this phone is offering, which you need to now replace from other more practical approaches. And just reduction of phones sometimes, as we can see, has clear-cut evidence. So even if they still have access, try to ensure that the duration is reduced with your own understanding of how you work with this kid. So what do we do going forward right now? Now, this is again for a lot of policymakers and tech giants to take care. This is where we as clinicians have very less control on, but this is something we can at least hope for. Firstly, from the tech giants' point of view, there is absolutely no regulation in terms of how they design these apps, considering all these safety features. They have to have inbuilt systems that actually can flag and minimize exposure to any kind of eating disorder promoting content, suicidal content, and even appearance comparison. Now, recently, we do have an Instagram update where it can flag the parent whenever the child searches about suicide. But that again is just a start. Now, this again requires a lot of furthering the design here. Algorithmic accountability is something which these tech apps are not taking. They do not have these amplification settings where they can actually stop if the child or a person is constantly focusing on one particular content, but it only functions to continuously amplify it further and further. There is no checkpoints there. That has to be given accountability. And the age appropriate safeguards are a joke in most, if not all, of the social medias. We don't have a system where we can verify the age proofs like an Aadhaar or like any kind of an age mark. These are things not required for anyone to just like that start an account. So these are things which has to be strengthened, and this should actually come from the tech giants themselves because they're very privatized, right? And overall, we need to restrict the overall access. And what about the policy here? The government also has to step in to do a lot of things. And overall, at this level, first and foremost, we need data, right? We need to first and foremost understand what these companies already have as data. So they need to be more transparent. And we also need to protect a lot of data that these companies are taking from these young children based on their usage. So they automatically are going to use these data for advertising, right? So they are already having a lot of these, let's say, a clear-cut agenda as to why this data is important for them. Now, again, this is where the government has to step in and to limit the collection of these data. And they need to conduct constant audits to ensure that these platforms are adhering to these mandates and if the age appropriate design codes are met. So there is, on the whole, there's a lot of work that needs to be done from a systemic level in both from the company point of view and in the policy from government point of view. And on the whole, we also have a lot of, let's say, responsibility as doctors to improve this digital literacy. The kind of things that these media is having an influence is sometimes clearly our own responsibility to try and make aware of as many persons or as many schools that we are in touch with. So finally, the ideal would be a multi-level prevention, right? It starts from digital literacy, where you focus on things in terms of how much you can talk to the parents about it, how much you can talk to young kids about it, and you need to also work on furthering clear-cut evidence-based therapies of CBT and ACT, which can be adapted to focus and change the body dysmorphic modules inside the child's head. And lastly, we also need to work on further guidelines in general to prepare parents in a digital age. So these are things that we have a lot of scope as clinicians to work towards the future. So with this, I would conclude with these following take-home messages. Firstly, yes, social media is no more a neutral exposure. It is algorithmic amplification. There is very less autonomy for kids there, so they have no chance to fight it. And now content definitely matters more than screen time, the kind of contents which objectify and improve or worsen the social comparison. And being adolescent is a clear-cut risk because of the neurodevelopmental vulnerabilities. And body dissatisfaction is actually a clear-cut trajectory towards a psychiatric risk factor of internalization. So the clinician must try to moderate or reduce, but sometimes prohibition may not always work. And so these are the kind of things that I want all of you to leave with. These are the bibliography. I would be happy to share all these materials if needed. So with this, I conclude and I thank everyone for the patient listening.
Thank you, sir, for that insightful presentation. We request all participants to kindly keep posting your questions in the chat box. We'll take them up during the discussion time after both the talks. It gives me immense pleasure to introduce Dr. Yamini Kannappan, whose work and experience many of us are already familiar with. She is a consultant psychiatrist at Kauvery Hospital. She completed her MBBS from Madras Medical College, did her post-graduation at Institute of Mental Health, then went on to do her DNB Psychiatry at SCAR. She was awarded the prestigious Dr. Sharada Menon Gold Medal for topping the country in DNB psychiatry examinations conducted by the National Board of Examinations. With over 18 years of rich clinical experience, she has been actively involved in research, academics, and mental health advocacy. She has received multiple recognitions, including awards for research and clinical experience, and has been featured among leading psychiatrists in the region. Beyond clinical practice, Dr. Yamini has been deeply engaged in training institutions, corporate organizations, and promoting mental health awareness across various platforms. Her areas of special interest include addiction and geriatric psychiatry. We are truly delighted to have her with us today. Over to you, Dr. Yamini.
Yamini, can you make it full screen?
You have to
Yes,
make it slideshow, ma'am. Slideshow.
Slideshow. Yes, ma'am. Just is this fine, ma'am?
Yes, ma'am.
Yes. Okay. Yeah. Okay. Thank you. At the outset, I thank the TNIPS, the Women Empowerment Committee, all my teachers, my senior teachers who are here, for giving me this wonderful opportunity to be able to present on such an important topic. And I thank Dr. Velprahanth for that excellent prelude that he gave. So that sets the foundation for my talk, where he has beautifully explained the neurobiological perspectives and what actually causes young brains to have such a profound impact on the media-driven body stereotypes. So my talk is going to be about the same impact. What does it do to adult women? And I'll be focusing a little more on Indian women. So here, if we look at, so when we talk about body image, as he said, it is a perspective about our own appearance and the attitudes about that perception. It's the thoughts, feelings, and emotions associated with body appearance. And there are two main things about it. One is the appearance evaluation, and the second is the size accuracy perception. So this is about body image. That's mostly about the physical attributes. So when we look at it, the data from India now shows that a huge number of women are dissatisfied by the way they look. And if you look at the AIMS ICMR Collaborative Mental Health Report of 2023 says, according to that data, at least one among every two adult women are dissatisfied about their body image. So a negative set of thoughts, attitudes, behaviors, and feelings towards one's own appearance. And what is of concern is that this dissatisfaction cuts across education levels. So in spite of education, One of the sample was medical college students who were just going to pass out. So in spite of education levels, in spite of being an urban or rural background, and in spite of normal health parameters, normal BMI, there were a huge population of women are completely dissatisfied with how their body is. So which shows that there is a very rapid socio-cultural shift which is going towards appearance-based evaluation. And in order to understand, because if we go by neurobiology, so, and also by the identity formation, so women in such, the identities are formed. There is maturation of our nervous system. So why are we not able to forego the impact that the society is now creating about how one's body type should look? So in order to understand, I think one of the major things about adult women is about aging. See, now it's actually like a FOMO, fear of missing out, when we are not using retinol, when we are not using a lot of things which social media influencers, dermatologists are perpetuating. So if we have to understand that, one of the main things is the double standards of aging. So here, if we look at how the aging of Rajinikanth and the aging of Aishwarya Rai has been projected by the society. So Rajinikanth has been celebrated for his off-screen authenticity, his choice to appear in public with his natural balding and his salt and pepper look is hailed as a sign of humility. Fans often view his physical aging as a badge of honor. And his aging does not diminish his godlike status. But let's look at Aishwarya Rai's aging, the way society has been viewing that aging. She faces intense scrutiny for any departure from her the most beautiful woman persona. She's frequently trolled for her weight, for her post-pregnancy weight gain, for her signs of visible aging, and also for her suspected cosmetic procedures. And the public discourse here often centers on whether she is maintaining her looks rather than her professional growth. So this is when body appearance takes over body functionality. We are moving towards the trend of seeing what the human moving against, looking at what the body is capable of, but it's just that what the body is. So there was a very famous quote which actually said that men have a body, but women are a body. And when we talk about aging, the again famous quote is that men age like wine, where women age like milk. So I think this is a very deep-rooted societal impression about aging. In fact, there was a very interesting thing when I was reading up. See, the minute we hear these words about crones, hags, and witches, what do we think of? What do we think of? The immediate visual that comes into our mind is about these women, old women who are ugly, who are evil, who are bad. But let me tell you that if we go behind, the literature actually says that crones, hags, and witches were once upon a time, they were leaders in their community, wise women, aged women who were leaders, who were midwives, who were healers in the community. But the patriarchal system, in order to put them down, later reversed this narrative of them being ugly, bad, and evil. See, in fact, the word crone comes from the word crown. Witches comes from wit, which is wisdom, and hags is about healing. So just look at the terminology which has changed about elder women. So in order for the society to consider that an aging woman is still relevant, then they have to maintain certain body standards. That is the double standards of aging, where as men age, they are supposed to gain value in terms of wisdom, in terms of power. But as women age, they lose value in terms of relevance, in terms of attractiveness. So in order for the society to celebrate these women, and in order to keep them still relevant, then society sets standards of aging. And in fact, this is an AI generated model. When I typed in what would an ideal middle-aged Indian woman look like, and this came up with this image, and this is the actual representation of the collective projection of the society, which was imposed upon Aishwarya Rai. That's what this is. See, the Indian standards, the societal beauty standards are one, the triple ideal, the beautiful, thin, and fair. So this is a three-part social imperative. And here, women in India, they have unique socio-cultural amplifiers where this beautiful, thin, fair, where the colorism is strongly associated with marriage prospects. So there is a need to fit into these beauty standards. And the second is about sharp Eurocentric features, sharp nose, large eyes, and facial symmetry. So this, and the woman had to be always well maintained, groomed, polished, and to remain youthful, and most importantly, to conceal aging, to age flawlessly. And at the same time, the woman should have done the work so well and concealed that it's not even known. So that's a double bind that is created. So if you see the pressures, and unless and until this has to be maintained, that's what the societal duty standards say. And when we talk about society, what actually sets this is the tripartite influence model, where it's the media, it's the family, and the peers. So now we are looking at, if media is going to be such a powerful driver of appearance-based pressures, then what is today's world doing to this societal beauty standards? So, as was explained in the last presentation, so this huge societal objectification, or the standards the society has set, gets so that's the societal objectification becomes internalized and becomes a self-objectification, which is actually what we call as an internalized male gaze, a bifurcated sense of self where women constantly evaluate themselves as an object, and then self-surveillance, whether in excessive monitoring of their self. And I think today we are in an era where we are looking at our faces more than ever. Unrealistic viewing of our own faces has increased through video conferences like the meeting that we are having now, the constant availability of video chats. All this has increased self-surveillance. So now with this objectification theory, the ageism part of it also becomes internalized, intertwined, and here adult women fear aging. Now it's about a preventive aesthetics where everybody is doing their best, because ageism, there was a very beautiful quote by an American writer, Susan Sontag, who said, aging is looked as a moral pathology, as a disease that needs to be rectified. And this applies only to women. So body ideals, that how women should look like, has always been there throughout centuries. If you look at in the 1980, there was the supermodel beach body that was supposed to be the ideal. And then it became the emaciated heroine chic look of 1990s. Then it became the yoga body of 2000. And then the Instagram body, which was promoted by the Kardashians of the 2010. And currently, now there's a Fitspiration trend. But if you just look at it, initially there were ideals. So this is how. But now the term has changed to trends. So which means there is a rapid change in these what society perceives as ideal. And these trends typically have a lifespan. The life cycle of the trends can be very short. So here we are seeing numerous trends which rapidly cycle. And adult women, we are exposed and there is a pressure to adhere to all these trends. So why is now the social media having such a powerful impact? There is an aesthetic revolution that is happening in the digital space. There is a creation of a new beauty culture, a new beauty ecosystem, which is which is much more than never before. And that is because of the visual megaphone effect of the social media, or it is a trick mirror that the social media is now presenting. So again, if you look at the statistics, more than not only adolescents, adults, 65% of the adults use the internet for social networking. And the advent of visual platforms, especially the Instagram, the photo and the image sharing social platforms has revolutionized aesthetic culture and has a very powerful impact over contemporary beauty standards. So one of the key post-millennial developments is the advent of these influencers. Now, when we look into the influencer psychology and how it actually impacts adult women so much, is that these influencers, at one point of time, the women compared themselves against women in the media, celebrities, but now whom they consider as role models or aspirational targets are regular people, influencers who carefully curate, idealize their, digitally curate their images. So these are regular people who seem just like us. At the same time, influencers are able to give an authentic glimpse into their everyday normal life. So they seemingly blend into our social networks, and then they become perfect aspirational targets. So what happens is that a parasocial intimacy is created where there is an obscurity about what their influencers' motivations are, what their lifestyles are. It just becomes an aspiration to be like them. So these post-millennial influencers have become larger than life trend setters. And at the same time, regular people are also able to create such an audience by following this, optimizing their images or putting up all these photoshopped, carefully filtered, edited versions of themselves. So their micro celebrity practices, but micro celebrity roles are possible for any regular person as well. And this again perpetuates this setting of idealistic beauty standards. And also, the most important as of now is that there has never been a quantification of the social approval which is gained now like ever before. But now a photo which is carefully curated, carefully edited, you can quantify whether you are socially approved or validated through metrics like likes, comments, and shares. So there is a quantification of the social approval, which can intensify the focus on the self-evaluation process, which again is now perpetuating the importance of appearance in social media and sets unrealistic beauty standards. So if we look at this psychology, then women are sucked into this validation and looking at unrealistic body ideals, also indulging in that and then garnering social approval, which sets off this very dangerous chain of social validation and social approval. So yes, as was discussed, this is one of the first times humanity is now, as women, we are not only comparing with other women, but we are comparing with idealized, unrealistic images, which has been algorithmically selected to represent statistical perfection. We are now comparing against our own algorithmically altered faces. So right in 2010, this Snapchat dysphoria, where the requirement or people going in for aesthetic surgery to look like their filtered images. So it has been reported as early as 2018, where women have been increasingly seeking cosmetic surgeries to look like their filtered images. So now when there is an algorithmic exposure, and if this is going to be relentless, if it's going to be constant, then there's going to be a development of a distorted perception of self. We forget what is real. There is a tendency to misperceive all these idealized images as the new normal. So, and these feeds are chronic, are relentless. So there were studies which showed that the more the quantity of time that was spent in image-based platforms, that correlated with body dissatisfaction and body image issues. So, and this is the way that it actually happens. So now if we look at the huge popular social media trends among adult women, yes, everyone's these are a few of the Korean glass skin trend, the clean girl aesthetic, the Instagram face, anti-aging youthful aesthetics, the fitspiration trend, the glow up culture. So numerous trends. And as I said, these trends have a short lifespan and then a new trend happens. But I think it's very important to understand that under each trend, there lies an underlying psychological message which is perpetuating a lot of the impact that we as clinicians are seeing. Even though we are probably not encountering adult women with full-blown body dysmorphic disorders or so, we are seeing subclinical traits of body dysmorphia. We are seeing aging anxiety. We are seeing appearance anxiety, which is all because they are pushed. The underlying psychological messages are lost in this pursuit. They are not looked into. Women think that if we do it, then it is self-care. It is branded as self-care. It is branded as self-love. But again, the message is about adhering to the societal standards which are unrealistic. So this fitspiration trend, I would just like to talk about it because that is the current trend. See, the fitspiration is a combination of the two words fitness and inspiration. So the current adult woman ideal is that it is a toned, it is visible muscularity, a slim body, firm lower limbs, and muscular upper body. This is the athletic ideal. Now, yes, it is an inspiring, there are people who get motivated by it. But here, if you look at the fitspiration trend, focuses on only one body type. And here, the focus is more on appearance rather than anything else. So when it becomes a very narrowed, defined beauty standard, that's when 25% of the people expressed dissatisfaction that they were not able to live up to this fitspiration trend. And these are the people who indulge in risky behaviors, unhealthy eating patterns, which leads to a lot of other patterns. See, if we look at the more the person tries, the more the risk-reward ratio becomes skewed, and they end up opting for procedures that might even be detrimental. See, if we look at the 2010, there was this Instagram trend, the Instagram body, about a very thin waist and a very big back. So here, there were a lot of women. The surgery which was popular at that time was the Brazilian butt lift. And let me tell you, this is one surgery that has been associated with high rates of mortality. But nevertheless, the craze for this surgery remains worldwide, globally, among adult women. So we need to understand that what pressures somebody to resort to such high-risk procedures. So I think the psychology behind it is what we just discussed. So this becomes unattainable. And because it's unrealistic, because it's idealized, because it's curated, And because the focus is only on appearance rather than functionality, so now there is the creation of the modern psychological stressors for our women population. Because we are not able to keep up to this because of one, the obvious role strain. When we move on to adulthood, there is a lot of responsibilities that a woman takes up. It is about caregiving responsibilities, it is about career balance, and of course, not forgetting the normal physiological changes which perimenopause, menopause, postmenopause brings about: the graying, the wrinkles, the difficulty in weight loss. But now, aging is looked as a pathology that needs to be corrected, that needs to be prevented. And women are supposed to be doing all this without actually visibly showing that they have done it. So they are drawn into the effortless perfection trap, which perpetuates all the psychological impact. So, as I told you, what we are looking at is a significant amount of appearance anxiety, aging anxiety, reduced self-esteem, lot of guilt, preoccupation when they're not able to keep up with the beauty ideals that the social media is now perpetuating. And the social media dysphoria, which the Snapchat dysphoria, huge amounts of body dissatisfaction, a cosmetic preoccupation. This is all of us know the amount of feeds that come about the procedures, the cosmetics, what we can use. So, and the aesthetic clinics are booming all over. Aging, any word which comes as anti-aging, I think that is the cue there, because here we are now fighting a discrimination that is so inbuilt, that's so invisible, ageism, which is now leading for adult women to pursue this relentless pursuit of these ideals. So as I said, lot of risky behaviors. As Dr. Velprahanth said, if we really have to intervene, I think we have to do it in a multimodal way. The society has to change. There should be a cultural shift, and there should be individual shift. There should be policies at all levels. But let me tell you about this very interesting campaign. I think a lot of us would be aware of this, which the Dove, the soap company, a bar of soap, actually changed the narrative of the society. So it was a very nice campaign. In 2004, they did a study, the Dove just did a study, and it found that globally, only 2% of the women considered them as beautiful. So there was a predominant amount who were dissatisfied. So Dove took up this real beauty campaign where it put up these billboards. What you're seeing here, it put up this across Germany, across UK, and here actually they portrayed real images of real women. No, not filtered, no models, no polished models. These were real women of different age groups, adult women. And there was also this these options that a passerby could actually press on the billboard to say whether what they saw was a wrinkled woman or a wonderful woman, was a fat woman or a fit woman. So, and this changed the narrative. And of course, it increased the sales of Dove 300 billion, but globally, it sparked a conversation about how adult women should be portrayed, because losing relevance is one of the key psychological aspects on why they want to keep up to these so-called beauty ideals or beauty images. And Dove actually made a starting point. But again, there was criticism about this campaign as well, because again, it focused on body appearance. So I think we need to be culturally sensitive to society interventions where we need to challenge objectification. We have to challenge these very narrow beauty standards. And has been already emphasized, I think what we really require is positive, supportive online communities that promote authenticity, and we already have. But I think it should, promoting more of this can actually create real narratives and reduced dependence on digital validation. and balanced social media use in terms of the time, in terms of the exposure to what contents we are seeing. Are we following people who are real or who are actually only curated? So yes, media literacy goes a long way. And I think we need to teach people, even at a very younger age, about all this, because there was a very interesting interview given by the actress Sonam Kapoor a couple of years before, when she actually told her fans, what I am not waking up the way that you are thinking I am. What goes behind an apparently normal photograph of me is about I have 6 to 9 people who work on my makeup, on my hair. I have somebody whose all-time job is to tell me what I eat. And I go through rigorous exercise patterns and I conceal this. There is concealer applied on parts of my body, which I did not even knew that had to be concealed. So please do not think that I wake up like this. There is a lot that goes behind, and do not take this as an ideal that needs to be followed. So I think more of this awareness creation, where whatever is highlighted on the social media is I think, because the studies have shown that educational qualification alone does not make this change. I think we need more focused, targeted media literacy, and that needs to be taken up by all people of the society, all game changers, the influencers, the celebrities. And yes, this was discussed in detail about how at a policy level, we need actions that need to be done. The educations, communities, promotive inclusive representations, regulating harmful advertisement, and providing tools to limit harmful content exposure. So yes, I have seen in my clinical practice where cognitive behavioral therapy has really helped. And so this ma'am, Dr. Hema said, you could share a case that you've seen. So here, this is a woman who's in her 50s. Actually, she was a known case of panic disorder. She just wanted to follow up. She's been on treatment elsewhere. She wanted to follow up. But when I saw her, actually, I was thinking whether I should examine her for extrapyramidal symptoms, because she actually had a mask-like faces. And when I asked her and when I examined her, and generally, so in a conversation, she said that she consciously tries not to have expressive facial expressions because she was worried about the wrinkles becoming exaggerated, or she didn't want the labial folds to be so exaggerated. And here, this was a woman with extreme aging anxiety, where she was not able to accept that there is going to be age-related diminishing of certain bodily functions, like in terms of her agility. But she actually went on to do a procedure for her thumbs, or where she felt that her movements were not like what it was before. So here there was an actual, and she went on these numerous diets, had a full-time nutritionist to guide her, and even she constantly used to weigh herself. And even if there was a small change in the weight, she used to become very, very panicky. And so she actually improved a lot with structured cognitive behavioral therapy. So that is what from my personal experience, but I think we might need more dedicated psychotherapeutic interventions to deal with the new emerging social media dysphoria. So with this, I end my presentation, and I really thank for this wonderful opportunity.
Thank you, ma'am, for such a comprehensive and thought-provoking talk. Today's discussion reminds us that media-driven body stereotypes are not merely socio-cultural observations. They are clinically relevant risk factors influencing identity formation, self-esteem, affect regulation, and psychopathology across the lifespan. We'll now open the session for questions and discussions. I request participants to kindly post their questions in the chat box. Please feel free to direct your question to a specific speaker or keep it open to the panel. We also welcome clinical experiences, different perspectives, and practical challenges encountered in your settings. Ma'am, I think we have a question from Dr. Lakshmanan, sir.
Yes.
If body dysmorphia is usually
Okay.
present only during adolescence and in young women, or is the diagnosis as such common even among women
Okay.
between 25 and 40?
Yes, yes. Thank you, sir, for that question. So, as I put up in my first slide, those were studies which were carried out in India in the last 10 years. And this population was mainly women between 20 to 45 years of age. And the median age was about 30 to 35. And almost in all of the studies, what was more prevalent was body dissatisfaction, not actual, they did not fulfill the criteria for a body dysmorphic disorder. So I think among the adult population, what we are seeing is more subclinical, sub-threshold clinical issues.
If I can come in,
Yes.
thank you, Yamini and Dr. Vale. I think you all have done a wonderful job of sort of stressing on this topic more than anything. Dr. Vale, this is to you because I just wanted your thoughts on gender dysphoria and body dissatisfaction, and especially adolescents when they meet us. Of course, we teach them about fluidity, but many a times, again, I think both of you can answer, even when they come in for wanting transitioning, and there is, I know it coexists and one doesn't cause the other, but we're seeing sometimes a lot of where you want to take time on sort of even wondering if it's transsexualism, and where there is more of body dissatisfaction and BDD existing. So just wanted thoughts on that also, and especially among the non-binary young people, who don't identify and have BDD. And so just wanted if Dr. Vale and both of you can take it up.
Uh, Thank you, ma'am, for that very important area that has not yet been, really had importance highlighted in the conversations we are having on a day-to-day basis. The anatomical dysphoria is something which starts even before prepubertal period for most of the kids who go on to develop gender dysphoria. And often their entire body image again is very much has a component of social narratives that also plays a role from their own understanding of what an ideal male gender identity or a female gender identity in body appears like. So it is inherently part of their journey. As they hit puberty, there will be a lot of dysphoria. Specifically, this entire anatomical dysphoria, which was initially in anticipation of secondary sexual characters, now with the appearance of secondary sexual characters, it's only going to get worse and worse for them. It is almost like an inevitable journey where they are going to hit that iceberg at that point. But the thing is, if the ideals here are set in a very realistic standards, now there is a different element of what kind of a trans sexual idealism towards a female body or a male body is set. There comes the culture and the societal expectation of that very individual person. They can come from a village background, and they can come from a rural setting, they can come from a school setting in a very urban place, and that actually shows a lot of variations into where they compare at the end of the day. And like the whole process, as you rightly mentioned, is quite fluid. They're constantly taking up these identities, wearing the identity, going through the process, and then they can choose to throw that identity and in place of another new identity. So this process is going to go on forever for them as they cross through their entire puberty. And because there is so many things that will determine what identity they ultimately hold on to. So it's very difficult to say whether this body dysmorphia is very much closely related to gender issues per se, or also mainly because of the things we discussed in terms of the entire society having an objectification ideal. It's a mix of both. That's the whole point. But it is inevitable that they will have that body dysmorphia that as a part of their anatomical dysphoria gets extended into puberty. I hope I have answered the question. Is so what I'm understanding.
Yeah. No. I just wanted, because see that so much, and I feel the dissatisfaction is much more higher, and
Yes, we can anticipate the process much ahead in these,
yeah.
rather these population than the typical adolescents actually.
Yeah. And also, Yamini, just as you rightly said, I think this increasingly from young adults, both men and women, uh, about all this cosmetic surgeries, and sometimes it's so clearly OCD. There's other OCDs, and they don't stop at it. And sadly, our specialists in other fields, even if we write to them that this is part of the OCD, I think they don't stop and they go ahead. I think that's also a big issue in terms of, I think, the bane of the whole cosmetic industry, and especially, I mean, when I speak to dermatologists, and like you can see the person having vitiligo also, related to excessive steroids, and but I mean, who apart from social media, sometimes I feel even uh, our peers and other specialists are to blame also, I feel, in the name of the
True,
aesthetics. Yeah.
true, ma'am. So in this,
Ma'am,
I mean, if we have, I just wanted to ask Dr. Velprahanth this question. So I think this issue becomes, because here I'm dealing with a neurodivergent young adolescent who's 14, with intense, where she is now fixated with changing her skin color. She wants to look like the Korean. And actually, I mean, even from all points of view, we've tried her on multiple doses of SSRIs. I've given her risperidone. We've tried to engage her in a lot of therapy. But actually, I also feel neurodivergence might actually be a more difficult, very challenging. Because to me, she actually says, she listens to everything and she says, Doctor, but if I am dissatisfied with how I look, so if I change, if I do this procedure where I change my skin, I'm going to be all right. And she also asks me permission to do that. So she said, I want you to say, okay. But is there a particular, in terms of psychotherapeutic intervention, do you think neurodivergent adolescents need to be helped differently? Is there other approaches that we might use, or if you could suggest?
Yeah, ma'am. This is an area which is, we can call this an Achilles heel because it's very difficult because they come with already present cognitive rigidities.
True.
And once they take up an identity attribute which they feel from their own logic, there will be a clear-cut justification as why this is the solution for their problems. And often there is even less from the previous conversation, we have neurodivergents who go into gender dysphoria. Again, it's a very cognitive approach that they will say that this is exactly what I want to fit in, and they are very, very rigid about it. And often any kind of medications may initially help in terms of reducing the preoccupation, but we really need to understand what is the problem that they're trying to fix. Because we try to apply our own social filters. Maybe it is just an identity thing. Maybe it's just a kind of an approach for them to fit into a larger social group. But here, those narratives do not fit in for a neurodivergent population. They have a very peculiar reason which only works for them. Let's say a person who I remember having both the gender dysphoria with the neurodivergent, for them going into a female identity, they believed that it would help their music career.
Okay.
It had nothing to do with the social narratives that we think is probably taking over. So there is a lot of unique, peculiar reasons that would be working for them, and that would be their justification to pursue this. So it works if we try and understand from that point of view at what is their unique reasons and what are the problems they're trying to solve. And that is where we can try to offer some alternatives. And sometimes it can switch, it can flip just like that. But sometimes when it goes into the territory of high level preoccupation, it can go into an overvalued idea or even delusional territories.
True.
There it becomes quite easily in a psychotic domain where we have to address.
Yes, thank you. Thank you, Doctor.
we have a question from Dr. Gajalakshmi. She asked for more information on orthorexia and if there is a difference between the rural and urban population. And also she wants to know if the premorbid personality plays a role in these body stereotypes.
So when we talk about orthorexia, it's a very clear derivative of what the social media narrative has created. And ma'am clearly talked about the concept of inspiration, which is happening these days. And so a lot of clean eating comes from little bit of tradition, but largely from social narratives. So I think there is a clear divide, but it can be present even in rural population also with a different kind of a context. So basically, what they attribute as a clean eating. So I remember having a rural adolescent girl who just stopped eating brinjal for many reasons, according to her, cultural concerns. So this again was very much explained by her cultural context, despite coming from rural. So vice versa, in urban, you have another setting where there are a lot of ideals spoken about how important good protein is, what are good sources of vegan protein. So many of these things can come and influence how much they take up. But one common attribute, as you rightly mentioned, is there is a lot of anancastia, which is definitely a thing that we can actually look forward. We actually try to assess if there is how much of anancastia is present in these people, and very likely it will play a mediating role in worsening the orthorexia. So this is what I could come up from my understanding.
Ma'am, I have a question for you. Um, uh, at what point does the desire to look good shift from normal grooming to psychological overinvestment? When does self-improvement become a self-criticism? Are there any markers that can help us identify when
I
these
think,
concerns move from being normal to being clinically significant?
okay. So I think the most important is to be clear with the goal that they are chasing. So is it, if the goal is going to become perfection, then it becomes unattainable. So that is something that needs to be clarified. So that's one thing. And then again, like any other, the time spent, the amount of preoccupation that they're going to have. See, in fact, about what actually it starts as self-care. It starts at self-care. It is packaged as self-care. But if we see, there is this self-care routines, now it involves layers and layers and rituals, beauty rituals, morning rituals, date, afternoon rituals, evening bedtime rituals. So when this becomes eroding, when this erodes into our daily lives, when it's going to cause disruption. So here now, it is when it constantly compromises our element of functioning. I think that extreme preoccupation needs to be taken account. And also, are they really, actually, I think here we can also answer Dr. Vikas's question about can we accept cosmetic surgery just as we are of gender affirming interventions or surgery? So here, this is when the preoccupation becomes so intense that nothing else can make them give them that sense of satisfaction. So we really have to look into what does the surgery, what are they aiming at? What are they aiming at? See, we have had adult women who sent by our plastic surgeons because we have a system in our hospital where they need to be screened for any psychological ailment. So here there are many women who wanted a breast reduction surgery because of their the problems that it actually causes. So we are not against cosmetic surgery, but it's very important on what they are chasing. Is it because now the influence of social media is so high, algorithm driven perfection chasing is so high? We just need to have more clarity on that. So as I said, as ma'am also said, now this preoccupation, the anxiety, the secondary distress, which comes out of body appearance, self-evaluation based only on the physical part of it, I think that will, but I think these are questions which we should start asking in our clinical practice. I think Dr. Vale can take on the first part of Dr. Vikas's question.
Yes, I think when we think about giving a reinforcement for, let's say, an intangible quality again. So what is remembering here is everything in moderation, including moderation, because the concept of parenting, again, as we all know, we grow up as a parent, we grow continuously as a parent. So there are lots of things that as an opportunity we get to appreciate and reinforce. The selective defocus on appearance is rather what is stressed here. Instead of putting too much of vulnerable level of focus on appearance, we try to little bit de-escalate, little bit of reduction in preoccupation on that, and equal focus on intangibles. So that actually gives a shift. So that's the kind of idea that we're trying to promote for a person where we want to reinforce their natural innate qualities. But yes, as a parent, it again has to be done with the responsibility and in moderation, that it should not become so critical where it then again garners a new level of guilt or shame. I totally agree with that point of view when you said that.
Okay.
Yes.
Yes.
Dr. Padma has actually shared her experience on a neurodivergent boy who started wearing his mother's clothes for brief periods, just with the idea that only women can be kind, understanding to others and suffering.
Yeah.
So, would you like to comment on it, ma'am?
Yeah, I
Again,
think that's, sorry, Dr. Vale, you can go
sorry,
ahead.
sorry. Yeah, sorry, ma'am. Yeah, that again very much is what we see, right? It's a very typical explanation you see from this kid. A mom is good, so wearing female dress means I'm as good as mom. So that's a very linear sequential reasoning that this kid is having. So all you need to do is provide an alternative pathway here. And again, if there is a lot of other reasons also, let's say there are actual experiences where this kid has something in terms of why he is adopting this kind of an experimental process. So instead of, again, we try to put our own social narratives, we try to understand from his point of view, which I think has already happened here. So we again try to reason with him and we see if it's just an experiment. So let him experiment and see, but then we can also teach him there are easier ways to get the same outcomes you want. So it's again a process of finding that rapport and deliberate with this kid, which might help us change his behavior.
And if I may add, Dr. Vale, a lot of over the years, a lot of people on the spectrum are on the trans spectrum, if I can say. So that also, as mental health professionals too, we also need to be aware and roll with that. I just wanted to add. I think there's a question by Dr. Mangla.
Mangala, yes.
Yeah, if you all can read.
So I'll just add what I think I know about. One of the aspects is that, thank you for the question, ma'am, the role of intimate partners in the adult individual's beliefs about his or her appearance. I think one of the things that I've seen in my clinical practice, about 2 or 3 women who wanted to look like a particular celebrity, wanted to take on cosmetic procedures because the husband wanted the wife, the spouse, to be like so and so. So I think we need to understand that celebrity obsession part of it in the male mind as well, where they impose it upon their spouse. So, I mean, that is one aspect which has come to the forefront in my clinical practice. So, but
And if I may add, that is,
Sure, sir.
yeah, okay. So I just wanted to add again the perspective that all the things that we have discussed here is largely prevalent in the male population as well. The body ideals that the objectification creates. in a male-centric point of view, there is a lot of ideals towards having a six-packs and the muscular body, and we see a lot of adolescent boys again constantly try to change the way they are in terms of their body. There's constant obsession with their hairstyle, and most of the evidences that we see is the association between social media and the body dysfunction is present statistically even after controlling for gender. So that's how much the influence of the society plays a role here. But then what we do see is when we see the gender variation, the intensity and the prevalence is much higher in females, considering how much they are more socially attuned with respect to their identity. Yeah.
So
I
we have a
would
question.
like to add that because ma'am talked about the LGBT spectrum, um, because there is no social structure for LGBT dating still in India, a lot of especially gay men they come into the dating spectrum through these dating apps like Grinder, and these apps they are as Sir said, all of them they come from America. So a lot of these apps they actually instill these body types even further. You have terms like, oh, you are an otter, you are a twink, you are a bear, and it so basically a young gay person in India who is 17 or 18 and they are trying to look for love, their basic idea of love and acceptance starts with the fact that there is an app where my body type has to be accepted first, and then only I have clients who tell me that it's very difficult to go on dates in Bangalore because everybody in the gay community is looking for their particular body types. So you will get rejected so often that you cannot even go on the first date. Forget about telling them about your personality and about yourself. So I think dating apps also do worsen the thing a lot. Thank you.
Jayanti ma'am, would you like to please give your inputs on the topic, ma'am, from your experience?
Oh no, ma'am said she'll be in a function and she'll sign and maybe then maybe,
Okay.
yeah, wrap it off. Yeah.
Okay. Shall we wrap it up then, ma'am? Are
Yeah,
there any other questions? So it was a very insightful session, and we've had a very active engagement from the participants and a very interactive and thought-provoking discussion as well. I thank both the speakers for such a lucid presentation. And we thank TNIPS and office bearers again. Ma'am, would you like to add something, ma'am? Okay, ma'am.
yeah, once again, just thank you guys, all of you on a Sunday morning for attending, and special thanks on behalf of the Women's Empowerment Committee. I think Dr. Vale for immediately agreeing, and Dr. Yamini also to not even hesitate a second and just say yes to our invite. And thank you very, very much. And looking forward to having you all in future to in any of our academic endeavors. Once again, thank you so much. And I think March 8th is Women's Day, and we have kicked off this in a really good momentum. Thank you so much. Thank you, Mrudula, Shweta, and Usha Nandini, and as part of the committee, and Dr. Sadanand. Thank you very much.
Thank you, ma'am. Thank you.
Thank you.
Thank you, ma'am.
Thank you.